Welcome to The Explainer. Today we're digging into a pretty weird paradox at the very heart of modern medicine. It's called the Overdiagnosis Dilemma, and it really challenges a basic idea we all have about health.
It sounds totally backwards, doesn't it? I mean, we're taught that a diagnosis is always the first step toward getting better. But what if it isn't? What if, sometimes, just getting the diagnosis could actually be harmful? We're going to unpack that exact question, and we're drawing from a massive scientific review of over 1,800 different studies.
Okay, so first things first. To really get our heads around this dilemma, we have to be absolutely crystal clear on what overdiagnosis actually means.
So here's the core of it. Overdiagnosis is not about getting a diagnosis wrong. It's about getting it right, but for a condition that was basically harmless. Think of it like this. Your doctor finds a real abnormality, but if it had just been left alone, it never ever would have caused you a single problem. The disease is real, but it was destined to be totally inconsequential.
And this is so important to understand. This is not the same thing as a misdiagnosis. They are completely different. A misdiagnosis is just a mistake. A doctor tells you you have something you don't. Overdiagnosis is when they find something that is truly there, but its discovery starts this whole cascade of more tests, treatments, and a ton of anxiety that you never actually needed.
So if this is a real issue, where in the huge world of medicine are people actually studying it? Which fields are most concerned about this?
Well, the second you look at the research, one thing just screams out at you: the sheer dominance of oncology. Based on that massive review, a full 50%, half of all the work being done on overdiagnosis is in cancer research. You can see the other fields on the map, but they are just miles and miles behind. So you have to ask, what is it about cancer that makes it the absolute epicenter of this whole conversation?
And this table gives us a huge clue as to why. It comes down to the tools. In oncology, it's all about imaging, right? Mammograms, CT scans. For mental disorders, it's the clinical exam itself. For infectious diseases, it's looking at biomarkers. So the very tools we're using to go looking for trouble are what's shaping this entire debate.
All right, let's zoom in on that giant 50% figure. Why is cancer the poster child for the overdiagnosis debate? Well, the answer is tied to one of the biggest public health movements of the last 50 years.
And here it is, the smoking gun: screening. A jaw-dropping 75% of all those oncology studies were focused on screening programs. You know, the practice of testing perfectly healthy people to try and find a disease early. This huge push to find cancer before it can cause symptoms is the very thing that opens the door to finding all those harmless, sleepy little abnormalities.
And when you look at which specific cancers are studied the most, it's really no surprise at all. You've got breast cancer with mammography, you've got prostate cancer with the PSA test, and you've got lung cancer with low-dose CT screening. These three make up the lion's share of the research because they're all tied to these major population-wide screening efforts.
Now, this might all seem kind of straightforward, but in reality, this topic is a minefield of debate, even among the top experts. And the core of all the controversy, the reason people argue so much, is that they can't even agree on what overdiagnosis really is.
So on one side, you have the purists. They stick to a really strict, narrow definition like the one we started with. It's all about biological certainty. The idea that a condition would never have caused a symptom in a person's natural lifetime. It's basically a scientific guarantee of harmlessness.
But then, on the other side, you've got this much broader, more philosophical definition. Here, overdiagnosis is more of a value judgment. A diagnosis gets labeled overdiagnosis if the harms of knowing, the anxiety, the treatment side effects, outweigh any possible benefit. You can see how these two different ways of thinking could lead to completely different conclusions about how big of a problem this is.
And this shaky foundation really shows up in the research. Over half of all studies are just trying to count how often overdiagnosis happens. But way less time is spent trying to define where the line for a disease should even be drawn. And get this, a tiny 3% focuses on how to actually talk about these insane complexities with patients. It's like we're trying to measure a room before we've even agreed on the blue parts.
So, with all this complexity and all this debate, where in the world do we go from here? Well, the authors of that big review, they point towards a clear, even if it's a challenging, path forward.
Ultimately, what it all boils down to is a call for a shared language. To make any real progress, the researchers argue that the entire scientific community needs a uniform typology, which is just a fancy way of saying a single clear system for classifying overdiagnosis. This would make sure that when scientists, doctors, and patients are all talking about this stuff, they actually mean the same thing. It's about building that solid foundation for a much more productive conversation.
And that leaves us with one final big question to chew on. In our quest for perfect health, driven by amazing technology that can find smaller and smaller problems, we have to confront something really difficult. When does our power to know more about our own bodies stop being helpful and start becoming a burden?